So today, I would like to introduce our speakers. So this is our quarterly federal community practice series where we share best practices, and we like to open up the opportunity for our VA clients to share how they use Get Well in the wild, as we like to call it. But for this webinar specifically, we're going to start off with Mike Krasinski from VISN 6. He is an infection preventionist at Salem VA, and he is also on the Infection Control Committee. He's a co-chair and the VISN IP lead. He is also a chair for the VA National Infectious Disease Service, NIDS, as it's abbreviated. And he will be joined by our Kayla Jackie. She is the Client Success Manager for Get Well in VISN 6. They'll be covering hand hygiene practices at the facility and the outcomes that they were able to achieve with Get Well. The next presentation that we will be showing you is presented by our Trish Hall. She is a Senior Client Success Manager at Get Well, and she supports VISN 21. She'll be sharing stories from 4 different VISN 21 sites that were recently implemented with point of care or inpatient for Get Well and what they were able to achieve in the fall reduction rates. Lastly, we will finish the presentation with Carl Morneau. He's our Vice President of Client Success in the Government Division, and he will be running through the capabilities that we will be able to enter into with our Get Well Anywhere Federal and FedRAMP ATO capabilities. So I will pass this over to Mike and Kayla. I am going to go off camera, and Mike and Kayla, if you'd like to take over, please feel free. Thanks, everyone.
Thanks, Nina. So my name is Kayla Jock, and I am the Client Success Manager for VISN 6. And today we're just going to talk about a project that we've been working on at the Salem VA for the last 9 months, and how we improved hand hygiene practices through the use of Get Well technology, and specifically Get Well Inpatient. So this slide here is just a quick summary slide of what we're going to dive deeper into in the rest of the presentation. But this opportunity came up because we recognized that hand hygiene was an easy safety practice that both patients and providers can participate in on a daily basis. And through this project, the Salem VA aimed to improve patient engagement in their own healthcare, and then also address any continuing education needs for staff conducting routine bedside care. So the solution that we decided to come up with was a custom prompt that was launched twice daily to patients' TVs. So once at 10 a.m. and then a second time at 6 p.m. But through this prompt, patients were made more aware of providers washing their hands as soon as they entered the room, and then in turn their own hand hygiene habits. So we saw some really great outcomes from this project. Like I mentioned, it's been live for about 9 months now. But since then, the Salem VA has seen a 63% reduction in hospital-acquired infections. And the Salisbury VA also went live with this prompt about a week after Salem, but since then they've seen a 43% reduction in HAIs. So just a little bit about the Salem VA. This VA is located in Salem, Virginia, and it's a fairly large campus, but they have 242 beds, and it's a teaching hospital that provides healthcare services to more than 78,000 veterans in the area. And currently we have Get Well in 3 units, so 4J, ICU, and PCU, which totals to about 57 beds. So the data that you'll see in today's presentation is going to be based on the data that we've collected from those 57 beds. And with that, I will go ahead and pass it off to Mike. Thank you.
Good afternoon or good morning, everyone. So quick background there. So Salem and Salisbury, we've gotten together. We're looking for ways to increase patient participation in our hand hygiene, which you know is a really good thing, a joint commission best practice, but it's really hard to execute. We also wanted to look at a way to see how our staff were doing beyond our secret shoppers, because what you'll note is the secret shoppers, I'm sure many of you have seen this, you'll get anywhere 95 to 99% or so, everybody's compliant, but then when your IPs and NPCs go around, you'll find often much less. And it's always almost impossible to get anything from inside a room. So we went for doing this. It would hit both encouraging the patients to do hand hygiene and also seeing how staff were doing. There we go. Let's see. So it had been previously purchased. You know, we at Salem had Get Well for a variety of different things. We got together in July, added that question when entering a room: did your healthcare worker, doctor, nurse, or other, wash their hands with their soap and water or use the hand sanitizer? So a very simple question. As you can see, and again, the goals were staff monitoring, patient education, and of course, see if we can decrease some HAIs. Here's a screenshot from the Get Well there. You can see there it's got a couple of our units on there, and you can customize it to what you're looking for. Of course, most of the time we're looking at monthly. So you can either look at your entire facility or you can break it down by units. And that's usually what we do. We break it down by units and add it on in with our other hand hygiene. Again, just a way to look at that. We're a 1C facility. As from previous, we only operationally have those 57 beds or so that are working at the moment. As far as the inpatients, the rest are CLC and mental health and so we don't get a lot from our secret shoppers. Sometimes 30 or less from a particular area in a month. And as you can see, this data was looks like there's about 2 months worth of data there, and there was over 1,000. We're averaging somewhere, I want to say 400 to 500 a month from the 3 units combined. So it really increased the number of observations that were occurring. And again, you can see that's just one from the 4J, again, for that period of time. It's one of our med surges. Over 500 observations. And I think in that period of time, we might have gotten 60 from our secret shoppers. So that's, 9 times as many from our patients as we're getting from our secret shoppers. So it gives a lot of good data. And then you can see right there, anywhere from 400 to 500 a month that we're getting. And the results have been really good. We have yes, no, I don't know. And we use the I don't know as an opportunity to remind the staff to be very obvious with their hand hygiene. Again, we saw a very significant reduction in HAIs. It was actually a little bit higher until month 9. We did actually have an HAI that likely probably could have been prevented. In Salisbury, I think about the same thing there. Just to we decided to look at the rest of the visit, and some of these numbers are a little alarming, but our Asheville facility has gone on up a little bit. Hampton, full disclosure, they're a very small facility, and so literally they had 1 HAI of last year, and this year has been unkind for them a little bit here. Durham has actually been decreased. The rest have decreased to different amounts as far as that goes, but we thought for us it was pretty significant to look, and especially since it's something that's already built in for everybody that has Get Well, and it's just a matter of activating to see how often you guys want to anybody wants to use it. Good. So these are the results up to this time, up through March, and as far as that goes. And the next steps for us as expansion to the rest of VISN 6. At the time that this was made, there was only a couple of facilities that were using it for their CLC, so we're looking to expand into there. And we also have a paper form that has just passed back through the Paperwork Reduction Act that we'll be using for our outpatient areas. This way we can cover, again, other areas of the medical center that isn't generally covered very well by secret shoppers, especially, and things like that. And that's all I have. And again, Mike Wasinski, one of the IPs at Salem, current VISN 6 lead, and the current chair of the Field Advisory Board. Anybody, any questions?
I don't see any questions in the chat. Kayla, did you see any questions come through?
No, not yet.
Okay, awesome. Thank you so much, Mike. That was a fantastic result and outcome. Love to see it, and love to see Get Well helping our veterans. With that, like I said, if anyone has any questions moving forward about this presentation or the upcoming presentations, please feel free to drop a question in the chat. But moving on to our next presentation, I'd like to introduce Trish Hall. And Trish, take it away.
Hi, everybody. I am Trish Hall, Senior Client Success Manager for the West region of the country. I support our sites in VISN 22 and in VISN 21. And I'm super excited. We had 4 new VA partners in 2020 fiscal year 2023 who implemented their Get Well technology, and they have seen some amazing impact on their fall prevention activities by leveraging their Get Well technology. I'm going to share some of that with you guys today. So of course, when we start working with our new sites, we kind of align the content on the Get Well system with their outcome goals that they want to make improvements in certain areas. Of course, almost always one of those safety goals is reducing falls. So all 4 of our VAs that went live incorporated Get Well content in their Get Well system as one of their solutions for educating, engaging the veterans in their efforts to reduce their falls. The fall prevention content that was added at all the sites were fall prevention education as part of the essential education that the veterans are required to watch upon admission. In addition to that, we have their fall prevention pathway that launches a few hours after admission that also kind of raises the awareness of different fall risk factors that we want the veterans to be aware of when they're in the hospital, and also additional fall prevention education. And then the third feature that we have in place is the Call Don't Fall prompts. There's a little image of one over there on the right. These appear on a regular schedule on the Veterans TV. Once again, keeping the awareness of fall prevention front and center during the veteran's stay. So just by implementing these basic features that I'm sure a lot of you have in place, these 4 VAs in their first quarters of being live with Get Well have reduced their fall rates overall by 33%. This actually equates to a cost avoidance of over $5.5 million. I'll go over a little bit how we come up with those numbers when I start featuring the individual sites. One thing I definitely want to point out, though, is we know that this is not all just because of implementing Get Well. We have amazing teams at all the facilities who are working on different ways to reduce falls and increase fall prevention education and awareness. So definitely we consider Get Well a valuable tool using the technology in those efforts, but they definitely have a lot of other interventions and activities going in place to prevent falls. Okay. So our first site, VISN 21 site to go live in 2023 is the Ionis Lugares VA Medical Center. They're in Reno, Nevada, 124 beds. One of the outstanding features that when I first started working with this facility is they were already very high performers in their veteran experience and clinical outcomes. So when we start working with a brand new site where we're building their initial content, we usually look at where they might be underperforming, and we might be able to add content that will help them achieve their goals. And it was a little challenging because they were performing so well. But of course, fall prevention, always an area we want to do better in for every facility. And we did incorporate that content in their system for their go live, which was in December of 2022. So they implemented Get Well technology in Q1 of 23. And since then, their results have been very impressive. Since implementing Get Well content, they have had a 41% decrease in their overall fall rates. You can see that as their increase of the fall prevention video education completion has gone up, they've had a very consistent downward trend in their fall rates at the facility. I don't have on this graph the way that we calculate the decrease in the fall rates is we use a baseline. So what was the number of falls prior to implementing Get Well? So for them, their fall rate prior to Get Well was 14. So we kind of extrapolate that if that fall rate had remained steady, how many falls would have been expected. And then we compare that to the, sorry, I'm messing with my teeth. They compare that to the actual fall rate. So they were actually able to prevent 23 falls by their many efforts and utilizing their Get Well technology. And for me, as a clinician, that's the part that I think is most important. That's 23 veterans who didn't have a complication, probably didn't have an extended treatment or prolonged length of stay because they avoided the falls while they were at the facility. Of course, there is a definite cost advantage to preventing falls, and the way that we calculate that, we use a Journal of American Medical Association article that's referenced down in the bottom left-hand corner that delineates an average cost of the fall in the United States is $62,521. So that's how we come up with the amount of cost that was avoided by reducing the falls, besides the obvious, more important clinical outcome of improving the safety for the veterans. And the next site to go live was Palo Alto VA Medical Center. This is a huge facility, 600 beds. They have 3 campuses, 2 of them are nursing homes, and then the main campus that's pictured here is their acute care and specialty care units, and with an additional of 1 other nursing home. It is the largest integrated healthcare system in the VA in terms of specialized programs, research, graduate medical education. Something that really stood out for me for the Palo Alto is they have a lot of specialty units. They are really subject matter experts and resources to other VA facilities for their work that they do in polytrauma, spinal cord unit, blind rehab, and all of their specialty areas are a resource and example for VAs across the country. So they went live with Get Well in April of 2023. So they came in on Q3 of that year. And since then, they have achieved a 30% decrease in their overall fall rate. Once again, their increase in education completed is aligned with their downward trend in falls. The one thing to note that I think is a good to highlight for this site is in November of last year, they reviewed and revised their fall prevention content. And I want to call that out because I know probably a lot of people on this webinar have had some of this content in place for a while. And we always advise that it's really valuable to go back and review what content you have in place and revise make sure that it's relevant and valuable for what's going on with your facility at the time. The Palo Alto did change up some of the education that they're providing to the veterans about fall prevention. So we're hoping to see them continue that downward trend going forward. So they had 35 falls prevented for that 30% reduction in falls at their facility over those 3 quarters that they've been live with the system. And we can move on to the next one is San Francisco VA Medical Center. They went live in June of 2023. As you can see from this picture, really beautiful, beautiful campus in San Francisco, up on the hill overlooking the bay and the Golden Gate Bridge. It's if you ever get a chance, go check out that facility. It's very impressive sites there. They are the largest competitively funded research program in the VA. So they have a lot of researchers and a lot of projects going on at that facility. They, as I said, went live in June of 2023, so came in towards the end of Q3. And since then, they have seen a 23% decrease in their overall fall rate since they have implemented their Get Well technology. Just a little bit of a call out for them. The week after we went live with their Get Well system, they started their Vocera implementation, which is, as many of you know, a huge project. So it did kind of take a little bit of attention away. Usually when we go live at a new site, we follow up with a lot of activities to increase engagement and awareness with the staff, but they had to focus on the Vocera. Even with that, though, they've achieved that 23% decrease, and we just recently went back and did some more education, started engaging the staff, so we really anticipate seeing them even see more benefit from their education and system going forward. They achieved 15 falls prevented to lead to that 23% decrease. And our final, fourth VISN 21 logo to go live last year was the North Las Vegas VA Medical Center. 140 acute beds and a 40-bed substance abuse and gambling treatment program. This facility was dedicated in 2012, a whole brand new hospital. It was the first VA medical center built in 19 years. I've been working with Get Well for 10 years, and I can say just about every VA that I have visited is an older building that has been updated and added on. Sometimes it's like a maze, finding your way around because of all the additions that have gone on through the years. But this facility is very impressive. It's just brand new, open, airy. It's a very impressive facility. So once again, if you're in Vegas, swing by and check out their beautiful crown jewel VA. So they also went live, yes, a week after San Francisco. We brought the Vegas VA up live with their Get Well system. And their results are also super impressive. They've had a 48% decrease in their overall fall rate since going live with the Get Well system. So once again, increasing that awareness of fall prevention and the education with the veterans, hopefully making a big positive impact on their outcomes. They had 20 falls prevented to reach that 48% reduction in falls. So overall, for the new sites in VISN 21, there were 93 falls avoided in fiscal year 2023. I do want to give out a call out to our very first VISN 21 facility was the Northern California VA, which is their main campus facilities in Sacramento with the CLC out in Martinez. They've had Get Well for about 3 years. I didn't highlight them on this presentation because we were looking at the brand new sites that came on board, but they also achieved a 26% reduction in falls in fiscal year 2023. So once again, their team's doing great work, and that equated to an additional 12 falls prevented. So that was 105 falls avoided for the VISN for the past year. So looking forward, as I mentioned with the Palo Alto site, we always want our sites to be reviewing and revising and updating their content. So I just wanted to share a couple of a few new features that we have available for sites to consider if you haven't already. The first one is our fall prevention screensavers. With our new UX, we now have the ability to put screensavers on so that if the TV is on and idle for a period of time, these screensavers come up just as they would on a computer. And it's a really great opportunity to highlight information, education programs with the screensavers on those TVs. This is 3 examples of screensavers that some of our sites have created and put in place. Of course, the fall prevention screensavers are a very popular and helpful feature to add to your system. This is a screensaver that was created by the San Juan, Puerto Rico VA and shared with us. It's not specific to fall prevention, but I thought it was a valuable tool because it's highlighting the advantages of having friends and family present when you're admitted into the hospital. So as you can see, there's obviously a lot of advantages if a veteran is able to have some friends and family spend time with them when they're in the facility. And of course, one of those many advantages is the probability of reducing falls by having someone there to either assist you or assist with getting help when it's needed. So wanted to share that from San Juan. This is a feature that I believe was already presented on a few previous community of practice, but I think it's a really great feature for sites to consider. And this is a call don't fall acknowledgement that appears at the end of essential education. So once the veterans have completed their initial video safety education, this disclaimer comes up and it requires the veteran to acknowledge it in order to continue on to use the other features and functions on their television. And I think there's a lot of value in them having to actively acknowledge or press the continue button that they have that they have to at least look at that screen at one point when they're first admitted. Sioux Falls created this, and they also have it set up so it documents back into the EHR when the veteran acknowledges the safety disclaimer. So you do have that documentation in place that the education was provided upon admission. And my last content to share was created by the Orlando VA Medical Center. And they added this fall prevention tip sheet to their Get Well system. In addition to that, they added a prompt that invites the veterans to view their tip sheet. And on it, it talks about them having a personalized fall prevention plan. This poster that is on here is in the patient room. So it's reinforcing a tool that's being used at the bedside by highlighting the poster that shows that the veteran's individual fall risk and which fall interventions they should be leveraging while they're admitted to the facility. It also has a little bit of great information about why fall prevention is important and making sure that their length of stay and treatment isn't prolonged by a fall. And the veteran gets prompted daily until they view the tip sheet. Once they have viewed the tip sheet, then they don't get prompted anymore. But I especially like when our facilities use the Get Well technology to highlight another tool that's also in use, so it all kind of combines together into one message for the veteran. And I think that's it for me. There's my email if you have any questions, or if you have an interest in talking to any of my point of contacts at my sites that I presented. I think a lot of them are on the call, and they're all happy to collaborate with anyone as needed.
Thank you so much, Trish. Those were awesome results. And, seeing those rates, that all the falls that we were able to prevent with the VA just in the VISN, amazing results. Thank you so much for that. I think there is one question in the chat. So I will introduce our next presenter, Carl Morneau. He is our VP of Client Services for our government sector, and he will be presenting on our FedRAMP and also the Get Well Anywhere federal platform that will be available with this FedRAMP ATO. So Carl, with that, I will pass it over to you, and thanks everyone for your participation.
All right, thanks everybody, and thanks Nina for the introduction. I just want to, before I get to my section, just want to shout out to everybody that's presented so far. Mike and team, y'all, these outcomes are just incredible. And it really, as a veteran myself who gets his healthcare at the VA, it really touches me when I see the impact that we're doing in our partnership together. And I just want to say this, I say it at the beginning of every call that I have with you all at the VA, thank you for choosing to work at the VA. You could choose to work anywhere, but you choose to take care of us veterans. And I want to personally thank you from a veteran. There was one question that came up in the chat. It's not really a question, it's more of a statement from Guy Bates. It looks like from the Washington, D.C. VA around implementing the screensavers at your facility. And so we will definitely pass that on to your client success manager, Kim Smeltz, who will help you get those implemented there as quickly as possible. So going into my section here, I just wanted to provide everybody a quick update on where we're at in our FedRAMP journey. And so if you can go on to the next slide for me, Nina, I appreciate it. So as you can see, we've been about 2.5 years now since we began this FedRAMP journey. And I know you all have heard us present on this a couple of community practices ago. But we're at a point now to where it's really imminent on where we're going to be awarded full FedRAMP authorization. And so I just wanted to just provide you all with a quick update. And for those who aren't familiar with what FedRAMP is a federal risk and authorization management program that provides and standardizes the approach to security assessment, authorization, and continuous monitoring for cloud-based products and services. And so you're probably wondering, why is that important to you as our customer? Because what it's going to do is it's going to allow us to be able to move your on-prem solutions into the cloud. And it's going to break down a lot of the barriers that are currently in place, with the on-prem solution, and how we've been working and partnering together over the last 13 years with the restrictions that were put in place by the ISA MOU that we have in place to support the use of our on-prem solution. And so what I'm going to do is I'm going to highlight some of those things that are going to be available, and they're actually available today. Because we did receive the VHA ATO, which is the authority to operate, that allows us to offer these cloud-based solutions to you as our partners before we actually get the FedRAMP authorization. And so I just wanted to clear that up if there's any confusion around that at all. So going on to the next slide for me, if you don't mind. So let me introduce Get Well Anywhere Federal. So with our recent award of that VHA ATO, Get Well Anywhere Federal, our digital experience and engagement tool for all the healthcare settings. So we're looking at from the ambulatory space to acute inpatient, home and long-term communities. We're really going to be focusing on recapturing those patients that have been seen in the community and bringing them back into the VA, to help deepen those patient relationships, improve clinical quality, and enhance business efficiency. And if you could go on to the next slide for me. So what does having the VHA ATO mean? So it actually means that we're going to alleviate all the confusion around what this actually means to, in our partners. The VHA ATO, which is part of the FedRAMP authorization process, allows us today to offer a multimodal experience across the entire spectrum of patient care. From before procedure to the inpatient to discharge, we are now authorized to offer many new enhanced solutions that were not available in the past. The only requirement is that you would need to migrate your current on-prem solution for GetWell into the Amazon GovCloud to unlock GetWell Anywhere Federal. So going on to the next slide, and this is going to break it down a little bit more for you all to hopefully this will make more sense to you all. So once you all make that decision to migrate your GetWell solution to the Amazon GovCloud, the topic of what solutions are available are going to be shared and demoed with you all so you can see the true power of cross-continuum patient engagement. Highlighted here are the three main buckets to include products specific to that point in the patient's journey throughout your healthcare system. So guided care, you hear us use the term guided care. What that is that is our GetWell Loop product, which is our ambulatory product that patients can access from their own device. And this product features 300 plus automated clinical workflows to help engage pre-procedure and post-procedure. GetWell Loop is designed to help prepare patients, provide follow-up care instructions while freeing up clinicians to improve clinical workflow. And so where the biggest value add is going to be, I know a lot of facilities have that one nurse that has to do all of the follow-up, for all of the discharges that have happened the previous day. GetWell Loop is a great product that's going to help free up some bandwidth for that nurse so she can really focus on the veterans that need to be focused on, and it helps weed out the noise from the patients that don't necessarily need a lot of help at that moment in time. So the next bucket there, the one in the middle called point of care engagement, this is the one that most of you all are engaging with today. So this is our GetWell inpatient solution. But in addition to this model, it's also going to include Rounds Plus, our digital rounding tool, a standalone digital whiteboard, which is a digital whiteboard that is installed separate from your patient's television, and GetWell Signal, which is a cool display device that sits outside the patient room. It's a digital device to help replace all that signage that you would typically see on a patient's door, such as contact precautions, fall rate, visitor restrictions. We would digitize all that and put it on an iPad that we mounted on the outside of the door. So that's a great product. That's all included with that point of care GetWell inpatient solution. And then all of these modules, and then the third one there, before I skip it, is the ED interactive experience. And so this is a really great experience that's available today. It doesn't require the patient to download anything. There's no account required to access it. And what it is, it's a link that we would send that veteran while they're sitting in your waiting room to help set expectation setting, smart triage management, and some entertainment to help distract and de-escalate, if there's some anxiety around wait times within your current emergency departments. And it also has the ability to provide pulse surveys as well to your veterans while they're waiting to be seen. So all of these modules, I just want to reiterate again, they're available today. They do not require you to wait for full FedRAMP authorization. The VHA ATO that has been awarded gives us the authority to be able to offer all these offerings. And so if you have any questions or you would like to schedule a demo, please reach out to your client success representative at your facility, and we can get those scheduled for you. So that is all that I had for my presentation today. What I would like to do now is open it up one last time for any questions for any of our presenters. Looks like we have a couple more that came in while I was presenting, so I'll just go ahead and read those out. This one is from Juliette Grant. For veterans with dementia, they are more challenging. What advice do you have for safety and falls prevention for that particular population? So that question would be for you, Trish, if you wouldn't mind taking that.
It's interesting because I have my mom who has dementia too. So definitely dementia is a challenging situation. My very first site had GetWell in the dementia unit. And there's all different kinds of levels of dementia. So I always say, GetWell is not going to be the solution for every situation and every patient. I think maybe the screensavers especially might be particularly helpful, and the reminder prompts if they're able to engage with the television, but maybe not so much diving into deeper into content. But I think that having the reminder prompts appear on the TV when they're watching television, and maybe having some of those screensavers in place might be good good tools to use in that scenario. Of course, if there's family members present, they can also be helpful with interacting with the system and assisting the veteran with their safety needs during their stay. I don't know, Carl, if you have anything else you want to add to that.
No, I think it's you made some great examples. So, you know, with that particular population, obviously they're going to require a lot of intimate hands-on, you know, from the caregiver or from the staff. And so the screensavers is probably the best option for that particular patient population. If they're able to engage in the true falls pathway, then I would highly recommend that. But I think you know, with the lower functioning dementia patients, the screensavers would be the option to go. And then we have one more comment from Maria Brobo. It's not really a question, but a comment. It says, I like the screensavers as well, and as an acknowledgement for our facility. So thank you, Maria, for all the great work that you're doing within your facility and partnering with us to, you know, improve the outcomes that we're seeing, you know, across our patient population. So thank you.
Yes, thank you so much, Carl. Thank you, Trish. Thank you, Mike, and thank you, Kayla. What a fantastic presentation and community practice webinar we had today. Thank you, everyone, for attending. Like I said, there will be a pop-up survey once you exit the webinar, so please just take a couple of moments to fill that out for us. It'll help us improve our next community practice webinar. But with that, thank you, everyone, and I hope you all have a fantastic day. If you would like the recording, please feel free to reach out to us. That's also included in the survey. And have a fantastic day, everyone.